Welcome to the show. Excited to have you, Larry. I'm really glad you made it, dude. Obviously, we're talking everything cybersecurity, and we want to just get right into it. And the biggest, we've obviously been talking a lot via social media, and we had a conversation. The biggest thing that I want to really kind of get us started with is just what is the actual risk in healthcare with regards to cybersecurity and the attacks that we're seeing, and let's just maybe start there first.
The biggest risk now, it's changed as of earlier this year, and that's actually patient lives. And when I say that, I mean it has been confirmed. It happened in the UK, but a patient has died because of a cybersecurity breach. The reason why, I'm sure everybody's heard of ransomware. If you're not, essentially hackers get into your system, then they shut everything down unless you pay a ransom. So they close everything. So when it comes to healthcare, you're talking about shutting down surgeries, scheduling, any type of treatment or care is completely shut down. And they usually have to reroute patients to nearby facilities if it's something urgent. So that's where it comes in, where there was an instance where a patient actually died because they weren't able to receive the proper care during the hacking incident. So that's what we're confronted with today in terms of cybersecurity on healthcare.
What would you say? Yeah, that's maybe not an extreme case because that is definitely something that can be more prevalent on a day-to-day basis. We're obviously talking about a hospital
Right.
system in that regards. What's the normal ramifications that you typically see? Let's maybe start with the larger institutions first. Like, what do you normally see in a hospital setting, and then what do you typically
I'm
see
going to
in
be
a
quite honest. I'm
smaller
getting
setting?
chills because that isn't an extreme case anymore. And the reason why patient lives of death is on the table and it can happen very frequently is because I would say 95% of the breaches that we're hearing about today are ransomware attacks. So that is the go-to because hackers want money in terms of hacking nowadays. It's no longer
Yeah,
really about we just want to wreak havoc and make things, a pain in the ass for you guys. No, we want money out of this. It's a business.
it's a
So
business.
that's when you hear about breaches today, I'm going to say 95% of those or 90% of those are ransomware breaches. And in ransomware, that's what it does. It shuts everything down. So this isn't minimum anymore where it happens every once in a while. Patient lives are at risk. Now, it's same thing in terms of small
It,
clinics, right? Ransomware is still the go-to. They think about it like this. So you don't find it a lot in healthcare because they're resource constrained. They don't have a huge cybersecurity team, right, to manage security or monitor security, govern it throughout the health system. But if you went to a Fortune 500 company, they have teams. Sometimes there's relative to how big the company is, they're not that big either, right? But there's more to manage there. What I'm getting at is hackers are doing the same thing. They have teams. This is not one person anymore hacking into a health system. These are state-sponsored hacks or hacking groups that consist of multiple individuals that are doing this. So that's what they're really up against. And I say that because what they're doing is they're reconnaissance first. So it's all mainly about the money, like I said. So they're looking at small clinics, large healthcare systems, anywhere they think they can get a big payout, and they're going to target those primarily. If they're not looking, if it's not a big payout, then they're trying to steal your health information, which is protected health information or PHI. So whether you're small or large, they're taking that information as well, and they will hold that. Even if they're not, if they are using ransomware, they'll hold that hostage as a way for you to pay up on top of your systems? Yeah.
hold up. So I got that 95% of because I'm hearing it and I'm like,
Crazy.
that's I've never heard that stat, and that's wild. So 95% of the cybersecurity attacks are uh, are of in ransom by nature. And walk me through it. Is it that these hackers, they do reconnaissance on clinics, smaller health organizations? They infiltrate that to then get the patient's information, and then they directly threat the patient, or how does that work?
Off a
Did I
little
get that
bit,
right? Am I
just
off?
for clarity. So 95% of the breaches that you're hearing about is ransomware. So when you're seeing something in the news,
Mm.
95% of the time it's ransomware is what I'm saying. But overall, actually, insider threats, surprisingly, is the biggest threat in terms of cybersecurity risk. So just wanted to clear that up. So when you
What's that mean?
sure,
Insider threat, and
so
then I'll
it
let
could
you kind of
be
get
either
finish up.
harmful intention, pissed off employee, somebody's paying that employee to steal information, so they're doing it inside, or by accident, not understanding procedure, and let's say sending your healthcare information out to everybody, every patient on this email list. So doing it by accident as well. Even though that's an accident, it's still a breach, and you can still get fined for that under HIPAA.
That's wild. I read this one book. It was from an FBI agent where they talk about corporate espionage, where they can go and target essentially like a business, and they ask different people for different pieces of information that they then use to hack that company's systems and extract money from bank accounts. And it's like the employees don't know any different. It is quote unquote on accident, but it's basically like espionage. Is that it's almost like that,
way
right?
of doing it. So we always think of in terms of data, something sensitive, PHI, credit card, et cetera, et cetera. But people, and the reason why we think of that is because it's always on the news. It's something that's what's really what we see on the news the most. But yeah, when we think of security, you want to think about proprietary information as well, right? Same thing. Chinese hackers will hack manufacturing facilities in the U.S. to get proprietary information to see how they're developing X, Y, and Z, because that's valuable as well. So yeah, espionage is big. It works, and we do it too. The U.S. does the same thing. We will hack. We will recruit.
Get at it.
Right.
Wait. We would never do something like that. Larry, get out of here.
So let me ask you a question. Let me ask you a question, dude, because you said, you're talking about patient information being taken, right? And then, so I think what we're looking at is that more so, say, like a mom and pop clinic, right? They're treating their patients like the local community clinic, and some random dude just decides, you know what, I'm going to steal your data. They're basically holding that patient information, saying, I'll release it all, or you pay me 10 grand or something like that. Is that fair to say? So that's basically when you're saying they're taking the data and they're holding it. It's just more so the threat of release it. And then what happens? I think the real question, most people are going to focus on the dollars spent to get that data back, right? So that $10,000 that I might have to spend, what's the actual ramifications if, maybe that clinic owner's like, screw you, I'm not going to do it, or I don't have the money to pay you. So that person who's in, overseas is saying, all right, then I'm just going to release all that. What's the ramifications at that point for that mom and pop clinic when their patient information gets just dropped all over the place?
They're in a very
across the internet
tight spot, and usually when it's done in terms of ransomware, essentially that's what you're talking about. What they'll do now is shut down your systems. So that, because you're right, because they were just taking the data at first, and some people would say, I don't have the money to pay this, right? But my systems are still functioning. So it's not that big of a deal, but now they're shutting down your systems. So it's like you can't do anything. You know what I mean? Really forcing you to pay up. But to your question, the ramifications are, number one, regardless if you pay or not, OCR, the Office for Civil Rights, they're the ones who enforce HIPAA. They will come and do an audit on you. I'm not sure if patients have the right to sue, but they can complain to OCR, and that will trigger an audit as well for them to come in, and OCR will fine you. And, trust, right? Your patients might not trust you anymore once they find that information is out there. So those are reputation. Those are the things you want to think about.
So just to piggyback on that, you mentioned that the hackers know, all right, if you don't pay or if you don't do this, and a business owner, well, I don't have the money, I don't have even an insurance policy on this. Let's just say, and the hacker's like, all right, I'm going to shut down your systems. When you say shutting down their systems, what have you seen hackers do,
Everything.
and what are those systems?
Literally everything. That's why hospitals have to reroute people to nearby hospitals because they can't function. All they go back to pen and paper. Like this isn't. Yeah.
So like computer, like CRMs, it's like
Yes.
phone systems, electrical systems. Like how bad does it get? Like, am I just throwing
It's
things out, or is it
I want
everything
to
there?
say I might be saying a little bit too much when I say everything, but it's your critical systems, your EHR, EMR, EHR systems, sometimes phone systems. It's those systems that you need, primary systems that you need to function. Now, your CRM, you don't really care about that, right? You care about having your medical records. Yeah, right.
Oh,
They're taking out the
I
primary
see.
systems, what's very critical to
Ah,
give care, deliver care.
can I so you see this through and through, just you
Every
being the
week,
founder of Inherent
I'm breaching
Systems and
it every
everything,
week.
and every week. And I'm curious, like, at what point should someone talk to you? And if something like that is happening, is it getting the authorities involved? Is that too late? Is it like, do you take on countermeasures? Because this feels a little bit like, I hate to say the word, but it feels a little bit like war, where it's like countermeasures, contingencies, right? Like different attack angles, stopping it.
Cyber
It's what
warfare.
it sounds
It's
like.
exactly, yeah, cyber warfare. When you
So,
hear that term, that's exactly what they're talking about. In terms of what they should do when people will reach out to me, you reach out to me beforehand. You reach out to me to put a
yeah.
governance program in place to reduce the risk of that happening. And if something does happens, it's drastically reduced the impact. Right. What you're seeing now is you have no security person there, or you have one security person there, or you have someone who's wearing multiple hats, and one just happens to be security, and they're trying to maintain that for the entire health system, which is just unrealistic.
Hmm. I, so So it's definitely not like if they're on the phone with a hacker, they're like, "I'm about to destroy all your systems," and they're like, "I got a guy, Larry, come in and handle this." It's not that. It's getting those things, those moats, handled around the business from a cyber perspective to make sure that you mitigate
It's a
that
part of
risk
operations,
through and
just
through.
like you have development, you have marketing, you have IT, you have security operations. It's a
Uh,
part of operations in business today. It's nothing you bolt on afterwards. It functions as a part of the business.
What, you mentioned at the very beginning about these, larger healthcare institutions that have a more, robust team simply due to the aspect of they're making more money. And that the smaller companies might just be a little bit limited on that. But, you still see large healthcare systems getting hacked. I mean, I've seen a few, and just like you have right over the last year, it's like $10 million. But if you're looking at that from a perspective of a smaller clinic, and they're saying if the big boys are still getting hacked, what the hell can I do? So you're speaking to that person. What would you tell them? Here's some really cost-effective things they can do to really
We're
safeguard
talking
what you're
about
doing.
actual technical things they can do. I would say, access controls. Make sure everybody has username and password and it's complex. Make sure you're encrypting all of your PHI within your business. Those are basic things. Make sure you have antivirus on your laptops, right? Those are all real basic things. But when we talk about healthcare, healthcare has compliance and it has HIPAA. And HIPAA has way more requirements than just what I just gave out. HIPAA has the same
Yep.
requirements for a small practice as it does for a large health system. Now, to the extent that you implement those security requirements are going to differ because the size, there's a difference in size, right? But you still have to adhere to the controls either way in some shape or form. And people hate to hear this, man, but it's a part of doing business nowadays. So when you build a business, make sure as a part of your business plan, security is built in. That way you budget for it. Now, that doesn't mean you go get five guys that come manage your small practice, but perhaps you're going to have an IT provider, so you get an MSP that has security capabilities, and you leverage them to manage security for you. But it has to. It's one of those things. If you don't have the expertise to do it, you can't really. I'm not going to say you can't learn it, but you kind of see where I'm going with this. You have to have it budgeted, and
Yeah,
you can't
yeah.
function without it. Especially in a highly regulated industry like healthcare.
Yeah, yeah. Maybe, if you can walk us through, like, if someone's a business owner and they watch this episode and, like, you know what, that is something I need to budget to, or we are growing and it does make sense for us to start. MSP,
Right.
managed service provider, right? Okay, cool, awesome. And so it's like when someone is going to get like an accountant or a
There you go.
bookkeeper or tax person, or it's like they need to have a little bit of knowledge, and they need to know what questions to ask them so that they're aligning with the right team, the right MSP with the right cybersecurity capabilities. What are some things you would advise them to think about, or questions to
That's a
ask?
really good question. We can knock this out in one question because, and I'm going to tell you, and I'm
Yeah.
going to,
Is their name Larry Trotter?
and I'm
No,
going to tell
not
you,
good.
I'm going to tell you why. You ask your MSP, are you familiar with HIPAA compliance? That's a great starting point, because if they are, great, because you need that, and that means they understand the controls that you need to have in place. Um, and that's the only really question I would ask at that level, and I'm going to tell you why. Because really, when you're dealing with an MSP that's multifaceted, they don't specifically specialize in security. They have multiple capabilities. You're probably not going to get, specialization, but so much as you would with any other business. So I think that's good enough to leave the question there. If you were going for a real niche MSP that essentially all they do is security and they specialize in compliance, that's probably where you're going to want to dive into more questions. In terms of that, like, do you know what the breach response requirements are in terms of HIPAA? What else might you ask? Ask them what other companies they've worked with, other type of healthcare companies have they worked with, in terms of HIPAA, that sort of thing. But you're really not going to find that with small providers. So I would just say, just ask them, are they familiar with HIPAA compliance? And if they say yes, then that's probably a good indicator to go as a small practice.
You've talked about some companies using a third party vendors, and as you're talking, obviously you're stressing the point of HIPAA, but I like you brought up the fact of when you're vetting a company, like in that instance, it's also knowing, all right, who do they work with, right? So if they're using other companies to assist in their security process, when we're talking about security kind of down the chain link, so to speak, what's the questions if somebody's using like third-party vendors that they should be asking as well, just as it relates to some
Right.
simple
So if you're
cybersecurity
using
stuff?
third-party vendors, this is a great question, because last year, 42% of third parties accounted for breaches in healthcare. And that was healthcare, of course, was the highest across any other industry, in terms of that. 42%, that's a lot. So you should definitely do your due diligence on your vendors. So some questions you should ask is, are you SOC 2 compliant? And that's another type of compliance where essentially an auditor has to come in, a third-party auditor has to come in, and they're going to audit your systems in terms of security controls, not necessarily HIPAA, but just security controls, to make sure that they're, have the proper controls in place, that sort of thing. Ask them, if a breach occurs, how soon will you notify us? That's another great question to ask. Ask them, how often do they get assessed in terms of their security? Ask them, have they been through a penetration test? Those are some of the questions you're going to want to ask. Now, if you're a small, you probably wouldn't do this if you're a small provider, but if you're a larger health system, you want to actually ask for proof and documentation of these questions that we're asking. Okay, you've got a penetration test done last year. Provide us the report. Is your SOC 2 compliant? Please provide us the report you got from your auditor. Do you have policies and procedures? Please provide us those as well. Because today we're in the age of digging deeper than just asking surface level questions, because obviously it's not working when 40%, 2% of breaches are from third parties. So
That's crazy.
So when you're looking at there's obviously a lot of talk nowadays too, especially just about, we're talking cybersecurity, but obviously even just being able to incorporate, and I don't want to get a lot into this, but incorporate AI and just that kind of tech into the business. But I think one of the struggles that we're seeing too, that I'd like to see if you can comment on, is just this balance between lack of regulation, so to speak, with regards to like how much protection do I need, or how much is the law saying I need to actually have versus what should I have. So where do you kind of fall in that of, hey, this is what the regulations are, and in some instances, there's really not much, especially on AI. There's been like minimal to anything implemented. So how do companies actually balance out what they really are required to have versus maybe what they should have?
In terms of AI, because it's really still a new technology, I think we get ahead of ourselves and think we should be farther along because it's just moving so fast. But it's really still niche. There's really only very few and far between people who are experts on AI, meaning they've studied this before generative AI was a thing. All that I'm saying, that all that is to say is it's still new. So the reason that we don't really have as much governance as we would like is because people are still figuring it out, right? So it makes sense in this day of time. But to the surprise, there is a significant amount of governance work being done. We did a LinkedIn Live about a month back. This organization called Chai, they released a transparency report. They do a lot in the AI space, and there's 250 bills at local states that are on the table now. Some have passed, some have been withdrawn, and some are in review now in terms of AI governance. So states do have things out there now. This is and check this out. New York has passed one of their bills that say whatever training data you're using, you have to have that publicly accessible on your website. Now, to me, that's complete overreach. That's complete overreach. But I guess just to yeah.
Tell us why. Like why you feel that way? Is it because like hackers can see what's going on and do counters, or what? Tell me.
Not even hackers, just competition. People see your training data on your website. They essentially have your secret sauce, and they can go replicate it, or they might can take a look and say, "Oh, you know what? They're doing a good job, but we can take this. You know how we can do this better." And tech is already cookie cutter. Everybody's using open source already, so it's not like everybody's. There are all these brand new ideas. That's why things pop up so fast. So now we're putting our secret sauce on our website. That's a little bit, bit of overreach if you ask me.
Yeah.
Can I go back? So I want to go back to what you were talking about a little bit earlier about making sure that you budget cybersecurity into your business. And so I know with like marketing, for example, a good rule of thumb is like 10% of gross revenue should be pumped into marketing. If you're really trying to attack some things, maybe 12 to 14%. If you're trying to coast, it's a little bit lower, depending on the industry, obviously. And I'm wondering, is there like a good rule of thumb? Like, is it half of revenue should go here? Should it be like a flat rate? Tell us a little bit about what you've seen that works for people that are needing to budget.
To be quite honest, I couldn't give you any numbers on how much to budget for security. I think it's really going to depend the size of your org, right? And then you really are going to have to do the research to see what it costs for a professional. To give you a good instance, for a good CISO, a full-time CISO, Chief Information Security Officer, you're going to probably pay $150 to $200K a year to have a CISO on your team. That's one person, and he can't do it all by himself. Essentially, he lays a framework out for everything and helps govern and actually, oversees the security team. So that kind of gives you an idea. But there are other options. Just like my company, we offer virtual CISO services. That way, you can augment your team, get the same expertise and quality without paying that full-time cost. That works for a lot of companies. So I think you want to. I would say take those some of the thoughts, some of the things I just laid out there into consideration when it comes to actually building out a team.
I think that's good. I do think that that makes a lot of sense. I know with some companies, again, I'll use the marketing example where they have like a fractional
Exactly.
CMO. They outsource some of their marketing, and then when they get to a certain size, then they start slowly bringing things in house. And so you're saying that it with what you have, like that might make the most sense for a lot of businesses. Like, hey, start there. It's same quality. You can get a lot of really great things there, and then as you grow, maybe potentially start bringing in some people in house if you can
Exactly.
afford it.
There's all levels, and you hit the nail on the head. I would say that at the lowest level, you can start working with an MSP, like we already talked about, who probably has some security capabilities, but they might not be niche. There's also, if you want to spend a little bit more, you can go with a niche security MSP. Then you can go down the vCISO route, or fractional, whatever you want to call it. And then you can also go in house if you want to. You rather have, I guess, a team 24/7 that's bigger 24/7, or someone there, you know working the standard 9 to 5, whatever you want to call it. But there are options out there. I really think the challenge is that, if you're small, people think it's not affordable. But I always say transfer, it's just like any other cost, you have to transfer that to the consumer. And that might mean costs are higher. But at the same time, I'm the type of person I like to buy premium products. So if that it's explained why this costs more, to me, it makes a lot more sense versus it's kind of just being bundled in, and I don't understand. So I think it's all about transparency, telling your patients, like, if you're a small clinic, hey, yeah, our price is a little bit higher, but we invest X amount of dollars in security because we want to ensure the safety of your information. I don't think that's too far-fetched.
Nah, man. Like you said, I think it's just
Yeah.
about being honest and telling them what it's for. And then realistically, it's like, all right, here's the ramification of not having it, which is kind of that side that people don't see. Somebody's like listening to what you're saying there, and they're looking at their own situation, saying, "Geez, we haven't looked at any of this. We've bought systems, we've installed them, implemented them. What would you recommend for that business owner to start gaining a sense of where are we at versus what do we need?"
An assessment. Really, to
Okay.
conduct
But
in healthcare, since we're talking about healthcare, a HIPAA assessment, right? So essentially, HIPAA is the law you have to follow in terms of security and privacy, right? Have someone come in, do a HIPAA assessment to see where you are in terms of each of those, and then by the end of that, you should have a detailed report that explains what you need to do in terms of HIPAA, and then you can really use that. Some of the stuff, you might have somebody who's very tech savvy and can help with a lot of that stuff and reduce costs, right? Or you might say, we're going to need to bring in a team or MSP to help us do this. But the whole idea is you understand where you currently are and you know where you need to go.
so it kind of sounds
Exactly.
almost like a gap assessment. Yeah. So the other thing I'd want to follow up on that too is I think you described it really well, where you say this is just another system within your company, similar to marketing, sales, what have you. Once the system is actually put in place and somebody they did a gap assessment or they looked at the HIPAA, they hire somebody like you, they've got everything up and running. What's the most common mistake people then make once the system's
Monitoring
implemented?
and maturing.
Okay, what do
Monitoring
you mean by
and
that?
maturing. So monitoring, right, is actually having systems in place that are looking for attacks, people breaking in, that alert you when people are breaking in. That's how you stop, right? So in today majority of healthcare, doesn't have those systems in place. Even if they have a decent team in place, they don't have those systems in place. So you want to have the monitoring systems in place, and somebody has to be looking at that 24/7 because hackers don't go to sleep. Right, it's the truth, man. Hackers don't go to sleep. In fact, when you're asleep is probably one of the times they're really going to, try their best because they know not too many eyeballs, if any, are on it. So you want to make sure that you're monitoring the network on a continuous basis and maturing. You'll often see more monitoring in place, but it's still rare than you ever see maturity. And essentially, that says, just like anything else, we want to get better year over year. Maybe we've implemented all the basic controls year one. In year two, we want to start implementing some more advanced controls. And we also want to measure what we currently have in place. And is it working? Is it not working? That sort of thing. So we can refine and reiterate as we move forward.
I love that. I wanted to kind of ask you on this because cybersecurity attacks are things that people see on the news. You mentioned that just a few minutes ago, like people see things on the news, and I feel like in some ways it's almost like cancer. It's like that's something that someone else catches. It's something that someone else goes through, not me. How much do you believe it is sheer ignorance on business owners? Meaning, like it's like they just don't know enough about it to prepare themselves or to budget it or to have those systems in place. And how much of it is like they do know and they just either don't know where to begin, they don't know where to start, or is like, oh, it won't
100% they
happen.
know, and 100% we'll take the risk.
Like we're good. Like, I
100%.
got it.
Because you have to
Really?
know, because HIPAA is a federal law, so you have to know. And the people making these decisions we're talking about senior leadership, so you have to know. You know what I mean? There's no ignorance in it. If
Mhm.
there is, then you probably shouldn't be running or holding that position that you are. Yeah.
So what are some so it's like you're in that position, it's federal law, you should do something about it. What do you think is the biggest reason why like maybe uh they don't take actionable steps to remedy this or prepare
They
themselves?
they I always hear they think it's a cost center, right? What's the ROI on it, which still kind of blows my mind because if you get hacked, which is very likely in today's landscape, right? It's going to cost you more than to actually do what needs to be done. And the other thing I hear is we don't have the money or resources, which frankly I don't believe because everybody's buying AI and AI isn't cheap. You know what I mean? We're not just talking about buying a scribe and leaving it at that. No, you still have to have a team that manages that scribe. Those licenses for how many you use. So, that's what I always hear in the healthcare space is we don't have the money to do it, but we rush to buy IoT. We rush to buy, new systems to provide care. We rush to buy AI.
You 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 make such a good point because here's how I'm kind of interpreting it is that there are a lot of people that come from business school. They come from these kind of places of study where everything is looked at from the lens of like
Right.
what's the return of that investment. Whereas like when they look at an insurance policy, which is in some cases it's mandated, but in other cases like you should have it just in case something goes down, right? Like just in case you want to have this, and you could, and even in insurance, you could file a claim and maybe it's rejected or it's like they'll refund you partially, but at least you have that as like a fallback. Why is it that maybe some people, do you think it's schooling that maybe some of these people that are coming into those executive positions are looking at it from like a strict ROI MBA perspective and like, no, you need to look at this more like a
You know,
safety policy?
I don't know why they're looking at it from an ROI. Really, I just think I don't know why they do. I don't have the answer to that. I don't know why they're looking at it from that perspective. As a safety net, absolutely they should. It kind of boggles my mind. I guess I don't know why. It's because it happens so much that we're to the point where
Mm.
guys, this is no longer people scare tactics that cybersecurity companies are using. No, we hear about this every day and it's huge and massive. right? So we need to actually start doing some things about this. Yeah, honestly, I don't know why they're looking at it like that. I just think people don't want to spend the money on it. But again, like I said, it'll cost you more in time, resources, money when you don't do anything. And the federal government is behind in terms of, HIPAA and the enforcement. I think that's what drives it a little bit too. The penalties aren't high enough, right? So if you're a huge company, you're like, we'll pay this penalty, so that's part of it. And I think there needs to be more accountability.
Larry, I like that, the accountability part. I think it's really important. And kind of circling with accountability, maybe to you, it's so interesting when we talk to doctors, business owners, on like, why do they get into business? And especially why they got into their chosen, business. So cybersecurity is just so different. Like, what got you into it, and why is this such a passion for you?
I love tech, man. When I was young, I love tech, and be quite honest, I followed my cousin's footsteps. He kind of guided me and told me, he was like, "Man, this is going to be the next big thing." When it wasn't a thing, and it gave you, shed some light. When I was in school, there was very few schools in the area that actually taught cybersecurity. Very few schools, from the
Mm.
collegiate perspective, that taught cybersecurity. So I started going down that path out of college, and because my college didn't have it, they just had IT, so I did that. Everything I learned, you know, homegrown, if you will, on the job, that sort of thing. I self study. So that's what really got me into it. And then I just fell in love because it was just a part of tech, and started my company because I was over the office politics. I thought things should. I like
Yeah.
the more of the responsibility, and really, it does help a business grow. We didn't talk about that, but it really does help enable the business. And I got an email from my client today. Asked her, how the contract went, and she said it went fine. They, accepted all our security responses, and we got a renewed deal. So deals don't go through nowadays if you don't have security in place.
I love that, man. We're going to do a really quick lightning round. I'm just going to ask you a handful of questions. Just going to be quick, knee jerk reactions. In one word, Larry, describe the current state of the healthcare cybersecurity.
Terrible.
What's the biggest mistake leaders make with AI?
No governance.
Mm. And what keeps you up at night about digital health?
My information shared in the public.
Mm. And last one is, what is one change every organization should make today?
Invest in cybersecurity.
That's what I'm talking about. In inherent systems, book your call with Larry Trotter today. Awesome, Larry. Is there anything else? We're good?
Nah, man, I think you nailed it on the head. Obviously, we covered a lot. I think the one thing that you had mentioned, and you snuck it in there, but it's very, very important, which is that this is up to leadership to really mandate better for their companies, right? This is not an IT issue per se. It's not a different department. If, like you said, if you're in that role, you have to understand how important this is to yourself, your organization, your employees, all the patients. And honestly, it's, outside of all the technical aspects, I think that's one thing that we can all understand, is that the people at the top have to be the ones with the mission, creating the culture, and driving the company forward in the right way. So, Larry, honestly, man, this was phenomenal. Really shedding a light on something that is crazy to say. It is so freaking important, but barely gets talked about. And I'm just glad you made it on here and could drop some high level.
Yeah. And Larry, also, if someone's watching this and they want to connect with you, what's the best way that someone can do that?
Reach out to me. Go to my website, inherentsecurity.com. And we specialize in health tech companies with vCISO services. We do HIPAA assessments. We do SOC 2 assessments as well. And we also have some partners where we provide some of the a la carte services like penetration testing and threat monitoring. So, yeah, please reach out. That's inherentsecurity.com.
Let's go.
Love it.
Larry, it was a pleasure. It was a pleasure meeting you. Thank you so much for what you do, man. It's really
man.
awesome.
Love it.